pure. So I'm Dr. Avani Maniar. I'm a dermatologist. I practice at Ghatkopar East, and we do a lot of things other than cosmetology, which nowadays is the trend. People believe it's a part of skin, yes, but skin concludes a lot of other things. So we are going to talk about everything under the sun which can get affected in winters today. So let me share my screen. I've made a short PPT for us to have a baseline and there. Yeah. So can you see it, Riddhi?
Yes, it's visible.
Yes.
Doctor, if possible, you can put it on. Yeah, that's what I was going to say. Thanks.
Okay.
It's clearly
Yeah.
visible.
So winter skincare tips. When we think of winter in Mumbai, it's not so bad, as Riddhi was mentioning. But I already have patients coming from the end of October regarding all the skin issues which can start off in winter. So why so? It's our skin realizes it before the weather realizes it in Mumbai. So we don't feel cold, but our skin gets dry, definitely dry. So what are the factors which actually affect our skin? So cold air, yes, the humidity goes away. Suddenly there's less moisture in the air. So our skin gets more irritated. You will notice whitish a sheen over your skin, especially over the lower legs, especially extremities. That is actually dry skin. So there are many ways to actually combat this. Just by applying a moisturizer, things get better. But sometimes you need a additional something more. Now, why does this happen only in winters? Now, filaggrin, which is one of the important proteins in our skin for maintaining the barrier function, it's like an umbrella for our skin. That is less, and its formation is less in the skin. That is why our skin gets more dry. Now, as I said, the skin realizes this before the weatherman does. So I get a lot of posts on Facebook and Insta asking something like, is there one skin product, which is very difficult to actually get. So many things are happening in our body. Our individual bodies have different needs. Now, what are the factors on which we can decide what to use on our skin in winters? So, what are the factors which affect moisture on our skin? So, age. When we talk about age, we are looking at an age group from 0 to 14 when the puberty hits, sometimes even 0 to 12. That is the childhood. Now, when we talk about childhood, the children definitely require more moisture than we do. So it is always better to shift to milder things after the month of October. We are already in December, so this is definitely high time we need to shift. So if you are on any harsh soaps or any soaps with perfumes in it, we need to shift back to moisturizing soaps. They should not foam so much. They should lather instead, and they should moisturize at the end of it. That is the end point you want in any bathing soap. Now, when we talk about puberty and menopause, so from the age of 12 till 40s, that is the age group which is kind of uh, better suited for this weather. Just by changing a few things here and there, they don't need additionally something to be applied during winter months. After the age of 40, you enter the menopause, or 40 to 50 is your premenopausal age, or for men also, the diseases like thyroid, diabetes, hypertension, all of these can, in the long run, give rise to extremely dry skin. So after the age of 40, yes, you need to additionally take care of your skin with moisturization. There are certain drugs which we use in our daily life after the age of 40. Normally, as I said, antihypertensives, anti-diabetics, blood pressure medicines, your cholesterol medicines kind of decrease the lipids in our body. Now, ceramides are also lipids in our skin, so even they get lesser. So if you are on medications, some of them can give rise to dryness of skin. So these drugs, when they are on, we ask in our history when you are on particular drugs, that's when we realize that you are going to be facing this issue in these months. So additionally, you need to take care till the winter months are over. Hormones, as I said, pregnancy, your menopausal age, as well as after the age of 60, when you have other ailments, during those times the hormones go haywire. That is when you require additional care. Humidity is something which is there in the coastal area. So, like Mumbai does not have so much of dryness experienced by the northern people. So, Inland, when you are going away from the sea, the humidity goes down, and that's when the humidity comes into the picture. That is when you feel more dry. So people in the north, especially, are already used to using these creams. Occupation. Now, if you are somebody who's in the office, which is always um, say you are indoors in an AC, the AC air is always getting dried up. These people experience more dryness. So if you are a little dry, you will experience 50% more dryness if you are somebody who's sitting in the AC. So why do we need to take special care? Keep hydrating, keep applying moisturization. So for people who are sitting indoors, it's also more important to hydrate and to moisturize. Now, some winter skin issues. As I said, I have had patients from October who are coming now. The first patients I see are psoriasis patients. They start getting new lesions. Throughout the year, they are maintained well, but by October, these come up immediately within the first few weeks only with psoriasis, new patches coming up, scalp is becoming very scaly and dry. That is psoriasis, which is something which is going to worsen in winters. So we start additionally adding a few things into their daily regime, which will tackle that increase or flare. Eczema again, is eczema a disease of winters? Yes, because you get more dry. Dryness is something which gets more experienced during winters because of decreased humidity. Your skin, the clothes which we wear changes. We'll end up wearing more thicker clothes, harsher clothes. Now, eczema is something which is related to itching. If you get dry skin, you will itch over that dry skin. The eczema recurs. So that's why indirectly it becomes a winter disease for us. Rosacea is something in which you get red patches on the skin, on the face, especially on the cheeks. Now, earlier it used to be believed it is only secondary to sunlight. That is not so. Any irritation to the skin, any dryness to the skin also will precipitate rosacea. Keratosis pilaris or chicken skin, this is something which you notice on the shoulders. Some people have it even on the lower back, upper chest, on the thighs. This is basically KP-like lesions, or KPs we call it in short form. They are bumps on the skin which occur during the winter months. Raynaud's disease is more of a medical term. Basically, you get uh, pain on the fingertips. This is because of the vasoconstriction happening in the capillaries at the end points. So fingers, especially nose, lips, these are the areas which become blue because of decreased blood supply. Now, what tips to be followed? What can we change in our daily regimen? Like we use in my earlier lecture, I had spoken about the basic things you need to add to your routine. Like you have a cleansing lotion. What type of lotion to use in winters? You have a serum, whether to use it in the winters or should you replace it with a cream? If you have a night cream which has more retinol and less hyaluronic acid, do we need to change the composition at that time? So some tips which we don't need to overhaul our entire regimen of the day. We need to just make a few tweaks here and there so that it takes us smoothly through the winters. So moisturizer. Which moisturizer to add? Now, there are so many over-the-counter moisturizers available. Preferably go for a cream formulation. Don't go for the lotion formulation, not in the winter months. Now, in cream formulations, there are three variants available. You will be like, which variant to buy? There is an emollient variant. There is a very creamy variant, which is your moisturizer with ceramides. So, which one to pick up? Now, if you are an extremely dry person, like a atopic skin person, or you are having a thyroid disease, you are having a diabetes, you are on medications which is causing you dryness, you go for the emollient variant. Emollient is written on the box. What is an emollient? Basically, it is an extremely waterproof moisturizer. So even if you take a bath, it will remain on your skin. Even if you apply soap, it will remain on your skin. So that is the kind of moisturizer you want for the winters. So emollients are the ones which is to be used. When do we use them? Now to be used in children, as I said, age group wise, you moisturize the child before you take him for a bath. So we massage the child. In the olden times, oil used to be used. In winter times, use the moisturizing cream or an emollient. Then take them for a bath. In the bathing time, what to be used, I will come down to that. So moisturization is not always just after bath. It can be even done beforehand. Then you can repeat it after with a thinner lotion. In the night, again, I would prefer if the moisturization is done. So twice a day minimum. How many times you can add more to it? Some people have extremely dry hands and palms and soles. Now, these areas we frequently wash too. So when we go to cook, we wash. When we go to eat, we wash. When we go come back home from outside, we wash. So every time you can moisturize your hands, at least palms and your hands and feet. So moisturizer, I hope I'm clear regarding that. How many times to be used? It's up to you. Minimum 2 times, maximum as many you want. Emollient, as I mentioned, it is extremely oily. Some people do not prefer to use it on the face, which is right. So don't use emollient on the face. Shift it only for the body. On the face, continue using your moisturizer which you are using. Especially acne prone skin people, you are going to feel dry, but you cannot use the really oily ones. So go for the oil-free moisturizers which you are using throughout the year. Just increase the number of times you use it. Lotions, more so, I would prefer only for a short duration they will work. So it's not really gonna work for winter time. You're gonna use it so many times otherwise. You will feel dry within 2, 3 hours. So creams, emollients are a preferred choice, not lotions. Lotions in the summer months. Serums for the face, continue using them, especially vitamin C and hyaluronic acid. They will add on to the moisture. So these are the serums you do not stop. But which serums need to be brought down? Retinol can cause excessive dryness. Retinol is something which you are using for anti-aging. That needs to be decreased in the number of times you use it in a week. So that kind of helps. If you're using any actives like salicylic acid, azelaic acid, these are the acidic serums or peels which you were using at home, you need to stop using them or at least take an opinion of a dermatologist regarding how many times you should use it. So face wash, as I was saying, something on the face, which what do you need to use? Whether you need to use a foaming face wash or you need to use a creamy face wash. Definitely, very logical, use the creamy face wash in the winter months, not the foaming one. The foaming one will make it more dry. I will come down to the questions at the end of it if possible, so that I think I might be answering them during the PPT itself. So, as I said, foamy or creamy, definitely creamy. Soaps or no soaps. So, I have patients who are on absolutely no soaps also. They just apply a basic emollient in the water. They put it in the water and take a bath with that water so that there is no foaming required because they get extremely dry even with a little bit of foam. So sometimes no soap is also fine during winters. If you are those extreme dry patients, psoriasis, eczema patients, thyroid patients, chronic renal disease patients, these people have such dry skin that even a little bit of soap might make it itchy. So do not use it. There are emollients available. There are face washes and body washes available which have oil in it, like Etoderm, like Bioderma products, like Sebamed products. They have olive oil in it. So oils in the soaps, these are also preferable during winter time. So body wash, definitely a yes. Soaps, not so much. Do you need to moisturize before you take a bath? Yes. If you are the dry people, dry community like in the atopic skin or children who are extremely dry, I tell them to moisturize even before you go for a bath. So the next on the list, shampoos. Should we shampoo or should we not? Or should we use the same shampoo on the hair as well as on the scalp? I keep repeating this to the patients also. Shampoo is for only scalp. There is nothing like a moisturizing shampoo. Shampoo does not moisturize your hair. So don't use a shampoo on the hair, use it on the scalp. Then the question comes up, can I use the conditioner shampoo combination? It works at different places. As I said, you need a shampoo on the scalp, you need a conditioner on your strands. So having two different things is always better. Otherwise, you're wasting the product. So which one to use for dry hair? Definitely sulfate-free shampoos for dry hair. But if you have dandruff, you should not be using sulfate-free shampoos. You should be using medicated shampoos, which are definitely with sulfates. Do you have a oily scalp? Definitely use the sulfate shampoos. How to use them? As I said, use the shampoo here, foam it here, let the foam wash through your strands. That is okay, enough for the strands. For the strands, then use a conditioner. After you finish washing, leave-on conditioner can be added to the strands as well as add a serum to the hair on the top. So Wash off all the shampoo and conditioner completely from your scalp before you leave the bathroom. So child-specific needs, there is something called as atopic skin. Atopic skin is the child having extremely sensitive skin. They are born with it. So you will find some children who are having extreme sensitivity to mosquito bites, to perfumes, to any colors. They will either be sneezing, coughing, or have extremely rough skin. So that is one indicator of allergic skin. So these children require emollients. These children require creamy body washes or body washes with oils in it. And as I said, they are called atopic skin. If the skin still gives out rashes, if its skin still becomes red, or if there is ulceration or eczematous changes, come down to a dermatologist because these children definitely find winters troublesome. So, few tips here. Switch to hydrating cleansers. As I said, when we are cleansing, you do not always need to use a foamy thing. So shift to creamy cleansers. Even when you're using a makeup remover, when you're removing it, it's always preferred to use a product which is non-alcoholic, even in a routine use. In winters, especially shift to the ones which are non-alcoholic. You can even use baby oil for people who are not having acne, or use the micellar water if you are having acne-prone skin to remove the makeup. Moisturize frequently. As I said, frequently can be just 2 times in a day. But if you have trouble in the skin, like atopic, eczematous, psoriasis, this type of skin requires more moisturization. Thicker the layer, better it is. Moisturizer, ideally, I prefer using after the bath. So how do I tell the patients is when you take a bath, pat dry the skin, let a little bit of moisture remain on the skin. On that, apply your moisturizer. It kind of traps the moisture. So immediately after bath on wet skin, if you prefer, do not even scrub the skin with your towel. Pat it. If you can air dry that skin, even preferable. Drink more water, that goes without saying. 3 liters of water is a must. Exfoliate for smooth, supple skin, not for everyone. Exfoliate just once in a week. If you are the dry skin people, do not exfoliate in winters. Sunscreen is something, it's my favorite product now. We need to stop using it in the winters or not. We have patients who travel abroad or who have shifted abroad. I tell them it becomes all the more important to use the sunscreen, not just in Australia, even in UK, even in US, in any of the countries in the northern hemisphere. Why so? Because you are closer to the sun. The rays are coming straight, they are not coming slanting. So you need to use a sunscreen more so there. In Mumbai, definitely need to use because it's not so cold, it's not so cloudy, no rays are blocked. It's like a routine sun exposure happening to your skin, so you need to use a sunscreen. Just shift to a moisturizing sunscreen or use a moisturizer before the sunscreen and on that apply the sunscreen if you don't want to shift your sunscreen. So this is something which you can easily manage in your routine, which is already present. You are using a sunscreen every day, just add your moisturizer to it before you put the sunscreen. Wait for a minute or two before any reapplication of a product. Avoid harsh scrubs or scented products, definitely nothing on the skin. You can use oils. Scented oils are something which I have found patients prefer adding it to the water and then taking a bath. So if you like scents, add it to the water or mix it with the moisturizer and then use it. A lip balm, definitely need to use it. Just be careful if you have perioral dermatitis, don't use lip balm with colors. Go for lip balms having SPF so that you don't need to additionally add a sunscreen there. But non-colored lip balms first and then on that your lipsticks. Be aware of irritating skin products. As I said, there are some active components which will cause issues like retinol, like salicylic acid, like niacinamide, like RG acid, arginic acid. So these are the acids nowadays available over the counter. We don't know how pure they are or how strong they are. They were suiting you before, but they might not suit you in the winter time. So need to dial back on the amount of use. Check it on a small area first and then go ahead with using it. So to conclude, basic tips are a few. Hydrating cleanser serum, daily moisturizer, have plenty of water. You still need a sunscreen, avoid harsh scented soaps, lip balm, and avoid products. If you have more queries, this is my address as well as the Insta address. You can get in touch with us there too. So I'm going to start with the question answers. I've been seeing a lot of raised hands. Vidhi, you'll have to help me out in this.
Yes, sure.
Yeah.
All right. So the first question we have here is, hello, doctor. I'm based out of Delhi. So yes, winters are on an onset here. I think that's just a statement. How to take
Hmm.
care of eczema, especially during winters?
So eczema is a skin disease. I say you should take care all throughout the year. Keep it hydrated, keep it moisturized. If you are not, add a emollient. Emollients are something which I said are really oily creams. So start using those at least 2 to 3 times in a day. If they are already infected, if they are painful, if there is collection of pus or if there's redness in it, then we need to give you an antibiotic for the season. 3 to 4 days of antibiotics, it should settle down. We even give steroid creams for eczema. Now, this is something which you do not cannot take over the counter. You need to consult and then go ahead with these. Eczemas can be tackled in a short duration of 1 or 2 months also. But it's just that the amount of creams which you apply need to be tapered off. So if you're not on any
Hmm.
medications, definitely get in touch with us. We do online consultations also. We can help you out in this. It's not something I can tell you over the what to buy over the counter, but emollients definitely can buy. Viraj
All right.
Rajpal. Okay. Yeah, I can
Yes.
see the one. Due to traveling,
Okay.
stress, dark circles, and puffy eyes. So traveling is something, if you are traveling routinely in flights, you get extremely dehydrated. Your skin is even more dry. Occupation, one of the things which I failed to mention was traveling. So when you travel so much, the flight air, the airport air, excessive AC, your skin gets more dry. So you will find a lot of travelers carrying their own moisturizers in their travel bags itself and doing that in the cabin itself. It's something which we need to actually take it as a part of our habit if you are somebody who's traveling that often. Puffy eyes is also secondary to that. Black dark circles can be because of dehydration also. Drink more water, sleep more often. If you are in the overnight flights, definitely put on the iPads and then sleep so that the light does not keep reaching your eyelids and you don't keep crinkling it. And definitely 6 to 8 hours of continuous sleep is a must. If you want, you can start under eye creams of vitamin C and hyaluronic acid. These are gentle, mild creams. They do not require prescription. You can get them over the counter also. These are basically night applications. So when you are traveling, if it is the night time, definitely apply them. If you are at home, definitely continue applying them. They should work in after a period of 6 to 8 weeks of continuous application. So if you can do that, definitely try it. How to take care of Raynaud's disease. Yeah. So if you get rashes from woolen gloves, wear gloves which are cotton. You can get them handmade and then wear your woolen things. Preferably do not travel to a colder country during this time. Warming up your hands is a must. There are medications we give for Raynaud's disease which need to be taken with a prescription, which are vasodilators. Basically, they will dilate your capillaries, but they do have side effects like hypotension and all. So preferably take it under the observation of a doctor if you have a Raynaud's disease.
All right. The
Yeah.
next one here we have is, I get rashes in sun. How frequently should I reapply sunscreen?
So a routine sunscreen works for 4 hours and
Hmm.
you need to reapply after 4 hours. So if I remember us being taught as a movie timing, you start at 6 o'clock, again repeat at 11 o'clock, again repeat at 2 o'clock, again repeat after that if you're still in the sun after four.
Hmm.
So for 4 hours, if you are going to wash your face, there are sunscreens which work for 8 hours also, if you're specifically bought those. And if you still get rashes, then you need to change your sunscreen. It is not suiting you. So 4 hours application is good enough.
All right.
Next one, I have acidity problem. My hairs have dandruff, and in winters, my scalp becomes so dry that the skin comes off like dandruff. Okay. So when your skin comes off like dandruff, that means you have something called as a seborrheic scalp. A seborrheic scalp is something which comes especially in winter times. So you need to add a antifungal shampoo to your regimen. Antifungal is your ketoconazole shampoos, your zinc pyriphone shampoos. Again, in India, available over the counter. Can definitely start using them on the scalp. If after using it for 2 weeks they do not disappear, then you need medicated shampoos, then you need to visit a dermatologist definitely. So If it's a routine dandruff, it will cure off with the medicated shampoos which are available over the counter. If not, then we give applications at night or antifungal orally so that they disappear. So seborrheic dermatitis of the scalp is also something which comes up in the winter months. It looks like dandruff, but it is not dandruff. So the next one, I have highly sensitive skin, which is also fragrance sensitive. Which moisturizer to use? So you should actually use moisturizers which are meant for atopic skin. There are moisturizers which will mention paraben free, perfume free, without any paraffin. These are the ones which you need to use. If you want some examples, there's Sebamed, there's Aveeno. These are the ones where it's specifically made for children who have sensitive skin because, as I said, they cannot even tolerate perfumes. They cannot tolerate the moisturizers which smell good. So you need a moisturizer which has absolutely no perfume. So Aveeno, Sebamed, good products, Bioderma, good products, Etoderm, PP. These are the ones which do not have smell. Definitely heavy on the pocket, but just during the winter months, definitely use them. In winters, I feel cold, but my hands and legs and palms become sweaty. So this is something which a lot of people experience. It is something which happens in winter times. It's if it continues during the other months also, we can definitely give you lotions which stop the sweating. This can be this it's a prescribed product again, but legs and palms getting sweaty is a very common complaint which everybody has. It has no relation with anything. It's not like increase in your sweat glands has happened. It's just the way your body behaves during this time. Avoidance, there's nothing to be avoided here. If you can just add, do you get this even in the other months? I don't know who's written this question at 5:14.
I don't know who this anonymous attendee is, but if you're still there,
Can you
I
just
think
add on to this? Yes. Do you still
yes,
get
please.
yeah, where is it gone?
If you get it in the other months as well, in other seasons as well, then please put it in the chat box or this box only, and then we can take it further from there.
Can coconut oil work as makeup remover for dry skin? Yes, it has been commonly used. Baby oil also can be used if you are not having acne prone skin. So definitely can use it. Especially the eye makeup, people do remove it with coconut oil. For acne pigmentation, which brand of moisturizer to use? You get acne OC moisturizer, emollient moisturizer, acne moist moisturizer. These are basically moisturizers which are water-based. They write on the pack which that it's non-comedogenic. So that's an important word to look out for when you're looking for moisturizers for the face. What do we do for fungal infection of skin? It appears as white spots. So if it's appearing as white spots, now it's something which we call as tinea versicolor. It basically comes when there is a change of season. It's a very routine fungus. All of us have this fungus on our body. But in particular people, it kind of gets flared up. That is when the population of that fungus has gone up in your body. So using antifungal soaps will help. The taking an antifungal orally with a prescription will help. So, and preferably do not wear clothes which are not ironed, which have been bought from outside and they are not washed. Sometimes people try it out and then you'll end up buying those clothes. So, we have seen it in people wearing new clothes without washing also. So, tinea versicolor is the infection. It comes basically on any change of season. So, using an antifungal soap definitely works well. I have dark circles even when I sleep good. Okay, do you have a family history of dark circles? Then that is something which will continue to happen even if you get good sleep. So that is something which we have not yet found an answer. There's no answer to it in science also. If you have a hereditary factor for dark circles, it is gonna come back even after treating it. So getting rid of them is not an option. Definitely reducing them is an option. So moisturize more, hydrate more, use a hyaluronic acid serum, use a vitamin C serum. These can be used in the long run. What you will notice is the change happening after a few weeks. So 6 to 8 weeks is like 2 months. Do use it. It definitely gets better. For the hereditary factor, as I said, there's nothing we can do for it if it is present. Mm. And now, my skin is dry throughout the year, due to which I have pigmented patches in few intimate areas and face. Knuckles are also dark. Okay. So basically, if you have extremely dry skin, that area gets darker. We call it amyloidosis, or it's a part of a disease in which your skin gets thicker to protect itself because it is so dry and if you keep scrubbing it. Now, if you have a habit of using anything, any loofah or any kind of humid stone to rub after a bath, stop it. One, after you take a bath, do not pat dry your skin, do not rub your skin, pat dry your skin. So it should not be rubbed in any form. Knuckles and all can be hydrated more. Use a emollient, which I was mentioning, throughout the year. Intimate areas as well as hands and face. You can even add a urea-based cream. There are certain Cetaphil urea-based creams available, especially for palms and soles and elbows and knees. These are the areas which get darker. So if you have areas which are dark on the knuckles and all, definitely can use it. Ona Kheer again. Are you online? Then you can just answer me right now. Can they unmute themselves? Can they get added?
I can unmute a particular person.
Oh, there's a Ohana Kheer. Kheer. Ohana Kheer.
Okay, I'll just do that if she's still online.
Yes. So we'll go
Yeah,
to
Yes,
hi,
the
it-
good
next
evening.
question. Yeah. Are you here?
Yes, I am. Very good evening.
Hi. Good evening. So, Ohana, do you experience the blackness all over the body, especially extensor aspects also, or only on the knuckles and knees and
Knuckles and elbows, I have it. I don't know. I have it around my neck as well because that is
okay,
again.
around your neck also, then there is something called as acanthosis nigricans.
Yes,
How are you
negligence.
placed? So how are you placed on your weight scale as in your body mass index? Is it on the higher side or is it
Yes,
normal?
yes. No, no, it's on the
On
higher
the
side.
higher side. So you need to bring that down. So that is a marker of diabetes, marker of thyroid. It's a marker of all the diseases which will increase during because of weight gain. So PCOS, thyroid, diabetes, three things. If you have any of these, the treatment is getting your weight reduced anyhow, whether by diet or by exercising. The pigmentation would disappear.
Okay, okay.
Yeah. Okay.
Uh, uh, one more thing. Like for
okay,
this,
I'll
I
just
used to
mute.
use. Am I audible?
You are still audible. Yes.
Yes. Can I use the Venusia cream which I use for?
Venusia Max, yes, you can
Yes,
use
I'm
it to
using Venusia
hydrate.
Max.
Definitely can use to hydrate. Use a urea-based cream also. You get Cetaphil urea on the knuckles and all. Even that will help.
Okay, but I'm surely going to visit you as I see your number. I
Yeah,
have certain things to discuss, so I think yes, I will visit you soon.
yeah, I'll see you then. Bye-bye.
Thank you. Bye.
We'll go to the next question. Very dry, itchy scalp. Definitely add a antifungal shampoo to your regimen. So basic antifungal shampoos are with ketoconazole. So if you are using a ketoconazole based shampoo, use it only on the scalp, don't use it on the hair. They get more dry. So use a conditioner on the strands and on the scalp, use a ketoconazole shampoo. So I'm from Bangalore, 27 with oily skin. Can you suggest some good sunscreen for winters with no white cast? Now, white cast is something when you get when you're using a physical sunscreen. So you can go for a chemical sunscreen. A complete chemical sunscreen will not give you a white cast. So there are La Shield sunscreen, La Shield Light, which is without a white cast. There are Cetaphil Sun Protect sunscreens, again without a white cast. So these are pure chemical sunscreens. Then definitely use them. Just the next one. I have dark pigmentation around my lip corners. I'm unable to get. So did you get the dark pigmentation after using certain products like lipstick which was new, or has it been there always? So that will answer your question, Vidit. You should not be using a lipstick which are stay-on lipsticks. They will definitely pigment your skin. If it is only the corners, do you get drooling of saliva when you sleep or not? So using a Vaseline at night on the corners definitely helps. If there is whitish pigmentation also coming out in the center, that means you have a fungal infection added to the dry skin. So using an antifungal will help. There's somebody who's raised an hand.
Yes, can you, Monica, I think you can put in the question in the chat box, please, or this Q&A box. All right, I think you can continue, doctor.
Yeah. So if you have that pigmentation, which is present even after hydrating, even after using an antifungal cream, then most probably it is a dental issue which is giving you that pigmentation. Your lips might not be approximating properly. So using a visiting a dentist might also help them. Ankush Rawat, I have a dandruff problem earlier that resulted into a hair fall problem. So I started using Kera and minoxidil 5%, but not finding a fruitful result. Also, minoxidil 5% is extremely good for hair fall. So your hair fall problem must have stopped, but the dandruff issue might have still continued if you have not used anything for the dandruff. What is your age, Ankush? If you can help me out. Ankush, are you online?
Somebody's written 24, so I'm assuming it's
24, na? Yes, so it's quite early for getting male pattern baldness. Okay. So for the dandruff, if you've used a ketoconazole shampoo and it is still not gone, then you need something which is stronger. So we use something called a cyclopirox, which is an antifungal shampoo, which is to be used on the scalp at least twice a week. Once that stops, your dandruff basically gives you a very unhealthy ground uh, things, which will not give you healthy hair. So if your dandruff issue is not sorted, your hair growth will also be still faulty. So get rid of the dandruff first if it is not gone. Minoxidil 5% is perfectly all right to be used for hair fall. So that is something you should continue along with oral and vitamins and biotin for your hair loss if you have not yet started. Can I use Venus? Yeah. You can use Johanna. So do we need to use sunscreen if we are in constant? Yes, you need to use a sunscreen if you are in exposure to the laptop. Your laptop gives out UVA light. That is your ultraviolet A. It is that immediate tanning sun rays. So definitely need to use a sunscreen or else use a screen over your laptop screen so that it gets protected. I have a dandruff problem earlier that resulted in, okay, it's the same one. No family history of dark circles. Now, then definitely start using the vitamin C and hyaluronic acid. It will give you results. How to reduce black pigment on the face. Now, black pigment on the face is something which can be caused due to a lot of reasons. One, if you are exposing yourself to sunlight without a sunscreen. Second, if you have had any traumatic lesions on the face, they can also pigment. Like even acne lesions will pigment. If you have had any kind of hormonal change happening, like um, pregnancy is one of the times, menopause is one of the, you get a pigment like a butterfly rash. It's called a melasma. Now, what type of pigmentation you have is something which you can reduce down after using creams and all once we figure out how deep it is. So, is it a dermal pigment? Is it an epidermal pigment? And accordingly start. But the first step is to start using the sunscreen. Any soap or powder you can suggest for fungal infection? Soap, or if you already have a fungal infection, no soaps or powders are going to help you. You need medications. If your fungal infection is cleared, then using a mycoderm powder or a adsorb powder will help in preventing further infection. But otherwise, ketoconazole soaps and powders do not cure you of the infection. Is loofah good for dry skin? Definitely not good for any type of skin actually. Do not use a loofah on oily skin also in winter months. Winter months may no loofah for any type of skin. In summer months, loofah can be used for oily skin, but never for dry skin. Even the cloth loofahs, no loofahs, absolutely. Neha, sometimes in winters I feel pain in my hair roots, especially when I flip my hair from left to right. It hurts badly. This is normal, but because you have a cyclical growth pattern in your hair, during winter months your hair loss is more. So when your hair loss becomes more, the roots which are empty, their nerve endings are exposed, so they become more painful. So that's why it is painful. Even if you tie your hair in a particular format, continuously every day also will hurt because then that pain is more physical. So preferably keep changing the sides, like we say, for the margins, at least every 2, 3 days. Pranjali Rane, there is one black spot on my nose and upper lips for last 1 year. I will not be able to figure out without a picture in this. On your nose and upper lip, any trauma, any history of acne, or any kind of scratch or uh, any spill, oil spill, or any hot water spill happening can give you a black spot. So for this, I'll need more history to answer. What is the way to apply shampoo directly on the scalp and not on the hair? So there is no direct way. Take the shampoo in your hand, a dollop of it, mix it with water, foam it in your hand, and then apply it on the scalp. Do not pour the shampoo straight on the hair. Do not take a shampoo straight on wet hair. Always wet your hair first, make it soaked, and then foam it on your hand, the shampoo, and then apply it on the scalp. So not going on the hair is not this hair I'm talking about. I'm actually talking about this hair. On this aspect, definitely some soap is going to reach, but it is not going to be so strong because you are foaming it in your hand first. There's a lot of puffiness under my eyes. Give some remedies. So puffiness under eyes can be secondary to sleepless nights, can be late night reading, a lot of it. So preferably you can, and even certain diseases, like if you have a kidney disease, you will get puffiness under your eyes at the end of the day or in the morning. Thyroid also gives rise to puffiness of eyes. So if you've tried the methods of sleeping well, not reading too much in the night light, preferably check all your blood reports for thyroid as well as your kidney disease and rule it out. If that is normal, that means it is a normal puffiness under your eyes. Just apply your hyaluronic acid and massage your skin from inside out. So when we apply a cream, it has to be from inside out. It is never from outside in. Hair fall increase. So when you have hair fall, basically you need to rule out a few questions in your mind. One, have you had any illness in the past 6 months which has been quite severe, requiring hospitalization? COVID, dengue, typhoid, malaria. These are the diseases I usually ask. If you've had weight loss to the extent of 2 to 3 kgs a month, it will also give you hair loss because your nutrition does not reach there. It is basically being used up for all the other important functions in your body. Or if you have used any kind of creams or lotions which are extremely strong for your hair, if you've undergone any treatments on the hair which has broken down your shaft. If these questions are positive, then you know the answer why you're getting the hair fall. Yes, Monica, you've asked a question. So the next one, I have very oily skin and sweaty skin. Can you suggest something to control the sweat? Now, very oily skin, you can definitely use salicylic acid face washes if you have it on the face. On the body, there are soaps which control your oil production, so can definitely be added to your regimen. But sweaty skin, depending on which area you're talking about. So if you're talking about palms and soles only being sweaty, or underarms also being sweaty, or all over the body if you're sweaty, then again that sweat, if it is smelly, that means there is some kind of infection which has already happened. So we need to treat that infection and then it gets better. To stop sweating, it is a little difficult thing like I was mentioning earlier. So if you have sweating only on the palms and soles, but all throughout the year, if you have sweating, there are ways to tackle it by creams and applications on daily basis so that you don't sweat. There are people who undergo Botox with us for the same sweating aspect. We inject Botox on palms, underarms, and soles because they sweat so much their daily function is hampered. So if that is the case, then definitely we can work out something for you. You need to meet me then. What about excessive hair fall during winters? Just a question. During the winter season. So during winter season, excessive hair fall, as I said, there is a cyclical channel followed by our hair, anagen, telogen, catagen. You go through a particular variant during winters, which is going to be more hair fall during winter months. But it also is better in the form of the texture wise, your hair gets better in winter. Your hair fall gets better immediately within a few weeks. So 3 weeks is when we expect the hair fall. So if you have already crossed that, you are in always already in the better aspect of your hair fall. Treatment for early gray hair is vitamins. Basically, if you are very low on certain vitamins, you get kernitis, that is early gray hair. We see it nowadays even in children in during puberty and after. It can be reversed. If till the age of 35, you can reverse gray hair without using hair dyes and colors. So there are methods to do the same. Multivitamins definitely help. Biotin has more than 500 micrograms. I think I've missed a few questions. I have pigmentation spot on my chin. The skin there is dry, but moisturizer does not help. So pigmentation will not get better with a moisturizer. It will get better with depigmenting creams or a spot cream. So if your spot is secondary to acne, then you need to use something which can reduce it. So there are tranexamic acid, there are creams which have demelanizing factors like vitamin C. There is there are combinations which are available which can be used on the pigmented spot. So moisturizer, yes, definitely if it is itchy, and along with that, vitamin C, kojic acid, your depigmenting creams will help. So creams for under eye puffiness, there are no creams for it as such. As I said, you can use hyaluronic acid based creams, which will moisturize as well as they are very easy to massage in. So you can definitely use those if you don't have any pigmentation. Some part of my palm is getting black spots and is increasing. Most probably you have a fungal infection if it is increasing. So definitely meet the doctor, Bhavani Singh. Face is sweaty. There's nothing much you can do about it, Poonam. You need to wash more often. You can use a salicylic acid based face wash. That will make it better. It will not smell and it will be dry for a longer period. So that is what we want. Even using powders, foundations in the form of powders will help. So there are liquid foundations, there are powder formations. Powder formations will prevent sweating. So can definitely add them to your regimen. I have dry thin hair. How can I keep it shiny and smooth? So dry thin hair, very easy to keep it shiny because your scalp produces oil. So when your scalp is oily, your hair will become apne aap smooth and nice and shiny. So how is your scalp? One, if it is dry, then you need to oil. If it is very oily, then it should work for your hair better. So just use a very mild shampoo, something which is sulfate free, definitely, and that along with your serums will help it keep it smoother. If you are not very comfortable with sulfate-free shampoos, use a shampoo with silicone in it. That also coats your hair and it makes it smoother. Wherever I use lipstick branded, most times lips get irritation and swelling. So even branded lipsticks can do that. So as I said, you need to use company products which are non-allergic. So you'll need to invest more in your lipsticks. Definitely can use MAC or any of those. These are non-irritant cosmetics. For lipstick, before you use the lipstick, use a moisturizer so that there is a coating formed before the lipstick gets in touch with your skin. And the lipstick should not be long staying one, should not be 24 hours one. Short duration ones are better. So you are 29 and female and have excessive hair fall. No, you'll never get bald. That is one thing, but your hair will become thinner. It can definitely become fragile. So if you have any of the diseases which I mentioned before, like thyroid, diabetes, any medications you are on, then definitely your hair fall is secondary to that. We treat the disease, we treat your hair fall, then it gets better. If you are nutritionally deficient, adding those nutrients to your diet will make it better. So if you are anemic, like your hemoglobin is low, your iron is low, adding that to your diet will help. Calcium, vitamin D3, these are also the ones which will give you hair fall. So again, if it is less in your body, you will continue to have hair fall, but you will never go completely bald. That is definitely there. Consultation fees. You'll have to get in touch with me, Ohana. My number is given. I'll just display it again at the end of the. Can you suggest treatment for gray hair reverse? There are gray X treatments. There are treatments of application as well as multivitamins. As I said, biotin more than 500 microgram twice a day to be taken for 3 months. That will definitely reverse your graying of hair. So your face is swelling during the morning as well as during periods. Now, hormonal changes which are happening during periods will give you swelling all over the body, not only the face. Only face swelling, sometimes there is a cardiac activity which is happening. Your heart is kind of giving you trouble, or your kidney is giving you trouble. You need to work it up. You need to get your blood workup done for the same, and then we take a call whether it is normal or not. Does hair reduction affect health in any way? Nothing. It has absolutely no effect on anything, not on childbearing, not on any hormones, not on any other thing of your routine life. So you can definitely go ahead with it if you are planning, but just see that it is a FDA approved laser. Don't go for lasers which have a dicey reputation. Vritti Parekh, is it advisable to use customized products from Skin Craft or Cure Skin? So again, if they are customized to your skin, definitely can use it, but then who's curating it is important. So if it is a doctor curating it according to your skin needs, definitely can try them. Should a sunscreen be used before or after makeup? Now, if your makeup contains iron oxide, I would suggest you can skip the sunscreen also. But if your makeup is not with iron oxide, you can use the sunscreen before you apply the makeup as a base. So your sunscreen becomes the base for your makeup, and on that you use the makeup. I have an issue of dandruff in winter. As I said, we can start an anti-dandruff shampoo before the winter sets in, and it be more frequent with usage of it. Once it is gone, shift back to Sunday anti-dandruff shampoos. Consumption of vitamin E definitely good. It is not going to harm you. You don't need to avoid it. You can definitely, it's a water soluble vitamin. If it is in excess, it gets washed out in your urine. So no problems with it. So definitely Harshada, you can take it. So I think that's it.
Yes, I think that's the end of all our questions. Okay, one
More questions? And I,
last
I can't
question.
hear you.
We've got here. I'm 29. I have curly. Hi, can you hear me, doctor?
Yes, I can. Yeah, tell me.
Okay, I was just saying there's probably one more question.
Hmm.
I think in the Q&A box, and then I think we can.
I have not
Uh,
seen it. I'm on the last question, Harshada Rani. Can you just read it out to me?
yeah, hello. I'm 29. I have curly hair. My scalp is oily. I have to wash once in 2 days. I also have hair fall issue. I am taking BTN Fort 10 mg and Adonis shampoo. Is this fine? As soon as I stop taking these medication, hair fall starts again. Is it normal? Also,
No.
how can
So
I help? keep my curly hair pretty, can I use any serum or gel?
You can definitely use all your curly hair products. Though there are so many good products now available in the market. You can try them out for your curls. The serums are absolutely fine. Leave-on conditioners are also absolutely fine. Now, BT and Fort, you said you are taking. Are you taking it for 3 months or more, or is it lesser? One, if you've completed 3 months, I would suggest you get a workup done for your vitamin D, calcium, and your CBC and iron levels. Because if you are stopping and again the hair fall starts after 3 months of taking them, that means there is some deficiency in your body which is not yet cured. So you need to tackle it the different way. Other thing which you need to again figure out is since you are 29, get a thyroid test done. Your basic levels, if everything is normal, that's one worry less. So these are the things you need to get checked up. For dandruff on again, dandruff and oily scalp with curly hair, you need to use a conditioner and a shampoo separately. So, as I said, your shampoo has to be only on the scalp. It gets washed off via your hair, that's okay. But then, very good conditioner, deep conditioning, especially on your curls, so that that does not get frizzy. So, both the things you need to manage.